This is a Cancer Survivors special series. Cancer is a deadly disease, and in fight with cancer, some win, some lose their life. This battle is not small either. At times, it takes months and even years for that matter to cure. In such a case, it becomes a true test of mental stamina of someone, because at times, even your family members take a back seat, leave alone the organizations, your colleagues, etc. But do organizations support cancer patients in all their capacity? Does your boss, your colleagues would care for you if you are diagnosed with a critical disease like cancer? Well, this is subjective in nature, but our today's guest has a lot to say on this side. In this episode, we are going to speak to Miss Ila Goel, who was fighting with this deadly disease, and but now she is living a normal life. She wants to share her experiences, her ups and downs, and whatnot. So let's welcome Miss Ila. Welcome on the
Thank
show,
you.
Ila ji.
Thank you so much for inviting me to the show.
सबसे पहला सवाल जो आपसे मेरा है वो ये कि कैंसर एज अ डिजीज इसका एग्जिस्टेंस क्या है? कैसे समझाएंगी आप किसी को कैंसर के बारे में जिसको कैंसर के बारे में कुछ ना पता हो? कैसे समझाएंगी उसको दैट यू नो व्हाट इट टेक्स टू गो थ्रू दिस डेडली डिजीज? किस तरीके से आप उसको बयां करेंगी?
So basically, cancer itself is a dreadful word. We all read about cancer, but these days, the kind of lifestyle that we are living, the food we eat, the kind of air we are breathing, so that all contributes towards developing cancer in many bodies. Some bodies have a good resistance, some bodies may not have. So even if you are in the same environment, so there may be people who might be infected, but there may be a lot of people who will not be affected. So in my case, like I was diagnosed with colon cancer in 2016. तो वो समय पर मेरी तबीयत एक साल से कुछ ठीक नहीं चल रही थी. आई वॉज हैविंग ट्रबल विद मोशंस, माई स्टमक वॉज अपसेट एंड आई वॉज ऑलरेडी सीइंग अ gastroenterologist. But nobody asked me to go through a test, some severe tests which could diagnose my problem, and it became very severe. So when I really had very bad pain in my stomach, so that was in March 2016. So उस समय मुझे एडमिट करना पड़ा because I could not tolerate the pain. And that's when this entire thing started off. So the doctors could not find anything for the first 10 days. Then we changed the hospital. I came to Delhi and in Sir Gangaram Hospital. So doctors were very good. So they were able to diagnose it within 24 hours that there is a tumor in my stomach and in my intestines. So that was how that it was diagnosed. So for I would say that when you get to know, so you have to keep your cool. Your mind has to be able to. Mind should accept the situation. So when it came to me, it was just like a shock to me. Definitely, it was a shock to me. It was a shock to my family. So, but then I thought that okay, now I have it. So what next? I have to fight through it. I don't have any other option. I have twin daughters. They were only 7 years old, and being a single mother, it was definitely a very difficult time for me to uh, accept the fact that I was fighting cancer and I have 7-year-old twin girls. How that is going to be? But I believe that faith in doctor is the first thing that you should have. Whoever is treating you, you should keep faith in the doctor. And the second thing, you should not let yourself down. You should accept the way you are. So that's what I did. That's what my family did. They were very support. My entire family was very supportive. My parents, my brother, my sisters, then my friends, my office. So the day I told them that I have been diagnosed with cancer, the first thing that told me was, Ila, don't worry, your job is secured. So that gave me a lot of relief that he, all right, so I have my job in place. They said, whatever time you need to take to get well, do it. Your health should be a priority. And that they kept throughout my journey. And that really helped me to fight this battle and be brave and to ensure that I come out of this situation very soon.
सो इला जी, ये किस स्टेज का कैंसर था जब आपको डायग्नोस हुआ था?
It was in stage 3.
ओके। एंड डॉक्टर्स का क्या कहना था कि कितना टाइम लगेगा क्योर होने में, एंड देन किस तरीके का ट्रीटमेंट होगा? क्या आपको सर्जरीज के लिए जाना पड़ेगा? सर्जरीज के बाद में कीमो, रेडिएशन ये सब भी होंगे? हाउ वाज द प्लान लाइक?
So it's first started with a surgery. They removed the tumor first. So that was the first step. So I underwent a major surgery, which in which they removed that part of my intestine, and then they went for biopsy, and then the doctor suggested that I require 12 sessions of 12 cycles of chemotherapy. So the protocol was decided, and they said that you have to strictly follow the protocol, which required admitting to hospital every 2 weeks. So for 2 days, I would be hospitalized because the chemotherapy would run for about 48 hours. And so those that took about 6 months to complete. And with every chemotherapy, obviously the body gets very weak. So and there was a change in my appearance, there was a change in my skin, my hair, and I lost almost all my hair. But I was fortunate enough that I have a very good hair growth. So the new hair kept coming, so I never felt bald during that time. And वो सब खत्म होने के बाद में उसके बाद एक और सर्जरी हुई थी, जिसमें उन्होंने फर्स्ट सर्जरी में उन्होंने मुझे कोलोस्मी दिया था, so that my intestines would get healed. And in the second surgery, they removed the colostomy and then they gave ileostomy, so that my body starts accepting the fact, and it gets cured better. So then it was ileostomy in my small intestine, and that was removed after 1.5 months. So in all, I had 3 surgeries, which first was for removing the tumor, second and gave me colostomy. The second was to remove colostomy and give me ileostomy, and the third was removing the ileostomy and completing the process. So the entire process took about 11 months to complete.
ओके। एंड ये 11 महीने, आई एम श्योर ये कोई बहुत आसान नहीं रहे होंगे आपके लिए। दैट इज़ वन। टू, क्योंकि 11 महीने का इलाज, और सर गंगाराम जैसे हॉस्पिटल के अंदर, जो कि दिल्ली के अंदर बहुत बड़ा प्राइवेट हॉस्पिटल है, नामी हॉस्पिटल है, किस तरीके के फाइनेंसेस की रिक्वायरमेंट पड़ी आपको? कैसे चीज़ें मैनेज करी? क्योंकि आपने बताया कि आप सिंगल मदर हैं, तो आई एम श्योर कि अकेले जाना करना तो पॉसिबल नहीं रहा होगा। तो
Correct.
वो जो पूरा 11 महीने का पीरियड था, वो किस तरीके से आपने मैनेज किया? ट्रीटमेंट के पॉइंट ऑफ व्यू से भी जानना चाहूँगा मैं, और मैं फाइनेंसेस के पॉइंट ऑफ व्यू से भी जानना चाहूँगा।
श्योर श्योर। सो बेसिकली वो समय पर मैं वडोदरा में रहती थी, और I was very fortunate that my in-laws are still supportive. They still support me and my children. So they are all there for me wherever I need any help, even for my hospital visits, for staying with me in the hospital to get my treatment done in Gangaram. So they were always there. My mother was there throughout the treatment. She stayed with me for the entire year. Then my sister, she lives in Noida. She was very supportive. So in all, everybody was supportive to me as far as my moral support is concerned. Finances were concerned. My parents took care of most of my finances. I already had some insurance cover, and the company had also provided me insurance cover. So both these insurance covers helped me to overcome the financial situation that time, and and the rest my parents took care of it, and even my brother-in-law. So he also took care of my treatment and my finances. So in all, I think I was very very lucky, where I had a very supportive environment. And one thing I learned from this entire period was that even if people who do not know you, But when they get to know that you are in a certain situation, you are in a critical situation, and you need some kind of help, people came forward, even those whom I didn't knew, but they knew me. For example, like they were people from, I was working as a director with the company at that time. That's a numerator. So earlier it was named as Market Track in Vadodara. So we had our bankers in Bank of India, and even the people, I didn't knew a lot of people over there, but they all of them they knew me, since I was a director of the company. So even they came to see me, and to tell me, to give me morals, to provide moral support to me, and to tell me that yes, this is something that I can fight it, I can do it. So, and then all my colleagues in the office, they would come and provide me moral support every day. They would come home. There were 100 people at that time in my office. So every day a batch of people would come to my home, and they would meet me just to come and talk to me, and just to make sure that I'm in good mental health. That helped me to believe that yes, there are people, there is a life to live beyond this, and this time will go away. And it definitely went away. So I kept my spirits high. I did not stop meeting people. One of my friends, she told me when I was at the beginning of my treatment, so she said that, Ila, whatever happened, however you may look, so just accept the way you are. So don't think that you look bad, so you don't want to meet people. Don't withdraw yourself from people, because these people will help you to fight this battle, and they will help you to come out of it. And she was so very right. So when you meet people, you feel elevated. So that's how I felt when I met people. So they were other people were really worried about me. They didn't knew how I was going to react, how I was fighting, and in the first few days when they came and met me, so they were all in a state of shock. I said, "All right, I'm alive, and you people will keep me alive. I'm sure about that." And they said, "Oh, yeah, of course, yes, we are there to support you." And that support, that mental support and emotional support, is something very much required both from the family and from outsiders. You should never withdraw yourself when you are passing through a critical stage, and you should never hesitate for help. That's what I did. Wherever I needed help, whether for myself or for my children, I reached out to people, and they were, if I needed help from one people, they were five people to help me out. So that was the journey that I was able to complete without too much of things. Yes, it took a lot of toll on my body. My body was very weak. I could not get up myself. It was trouble. It was difficult to walk. I had a lot of neuropathy in my legs and my hands. It was even difficult to hold spoon at that time. सो एक चम्मच पकड़ने के लिए भी मुझे बहुत एफर्ट करना पड़ता था, तो चम्मच खाना खाते खाते हाथ से चम्मच भी छूट जाता था। ऐसा भी सिचुएशंस आई हैं। But then, like, I just worked out on it. So physiotherapist was there. So there was, I would say that कि जब आप मुसीबत में होते हो तो शायद सभी लोग if you don't have one person in your life, if you don't have your husband in your life, then the entire world comes to your support just because you don't have your husband. So I felt that it was just a very good thing that everybody was there to support me and to keep me elevated during this time. So वो सब मेरे लिए बहुत मायने रखता है कि, और मैं यही चीज़ मैं सभी को ही बोलती हूँ जो भी कोई क्रिटिकल डिजीज से लड़ रहा हो, स्पेशली diseases like cancer. So accept yourself, accept the fact that yes, this is there, now I have to fight it. And that will help you to keep going. I read all good books I could read. I listened to all positive people. And my doctor, he said that, Ila, stay away from people who would demotivate you, who would ask you questions which would make you feel all the more bad. You should stay with positive people. And even if some people said, Ila, kaise karegi, kya hoga, ab kya hoga, ye kya hoga. So those are not the kind of people who are really there to help you out. The people who are there to help you out are the people who would say, Ila, you can do it. Yes, you can do it. This is just a matter of some time. It's just a matter of few couple of months, and you'll be back on your feet again. And that's how it worked.
क्योंकि इस शो के शुरुआत में ही हमने एक चीज़ बोली कि हम सब इस एपिसोड के थ्रू ये ज़रूर जानना चाहते हैं that how organizations are supporting their employees once they are diagnosed with any critical disease such as cancer. In this case, your organizations, of course, supported you in all its capacity. But do really all organizations, maybe some now, do they all really support?
No.
Since the organization was in Vadodara, maybe people are still very warm. But do really people are warm in bigger cities also, where most of the organizations, the MNCs, have their offices?
Not really. So this organization I was working with, Market Track, so that's a, US based company. So their headquarters are in Chicago. So it is like the top management is all Americans. They are very considerate about people, and they were very supportive. If at all I was with any other organization, I don't think I would have got that kind of a support. But yes, some organizations are supportive towards their people, and they understand what the situation is. They allowed me to work from home whenever I wanted. I did that, and I kept working throughout my journey. But yes, I could not go to office because my body did not allow me to go. But whenever I felt that I was energetic enough, I worked from home. So अभी मैं जो current organization में हूँ, तो I don't know whether they would have supported anyone um, who had that kind of a disease, because sometimes not all the organizations are very supportive about the situation. So usually organizations को लगता है कि कुछ organizations को ऐसा लगता है कि नहीं, we don't want to invest in that person, and it's a long journey, it's a long period of survival, it's a long period of uh, recovery. और अनसर्टेनिटी डेफिनेटली होती है, एवरी मोमेंट देर इज अनसर्टेनिटी कि व्हाट नेक्स्ट, व्हाट नेक्स्ट, व्हाट नेक्स्ट, सो वेदर यू विल बी एबल टू मेक इट थ्रू दैट कीमो और नॉट. सो बहुत सारी चीज़ें होती हैं अनसर्टेनिटीज़ की, और बहुत सारी ऑर्गेनाइजेशन सपोर्ट करती भी हैं और बहुत सारी नहीं भी करती. पर शायद अभी आफ्टर कोविड आई बिलीव काफ़ी ऑर्गेनाइजेशंस सेंसिटिव हो गई हैं हेल्थ को लेकर, और बहुत सारी ऑर्गेनाइजेशंस को ये लगता है कि हाँ, ये सिचुएशंस हैं और हेल्थ इज़ अ प्रायोरिटी. काम तो चलता रहेगा, काम कभी किसी भी ऑर्गेनाइजेशन का किसी के लिए भी बंद नहीं होता है. So that is what I have felt. It's only you should know how you have to manage your work, how you can engage more people, how you can share your workload with people, how you can seek help so that your work gets done without affecting anything. So ये सब चीज़ें I think organizations में आजकल sensitivity है. So they are more adaptive, they are more supportive when anybody needs that kind of a help due to health reasons and not. Even in my current organization, I remember one of my colleagues, his father was diagnosed with cancer. So I talked to him, and then he said his parents lives very far off, somewhere in Banaras, somewhere near Banaras. So then he was very worried how he was going to take care of that treatment. But we allowed him to do work from home whenever he could, and he can take off the rest of the time. So that really helped him to work out things back home. So that sensitivity is definitely there. So I would say people are more sensitive now than they were about 10 years back or 15 years back.
Okay, so you have to take break also from your organization
No,
for the
I kept
treatment
working throughout the period. So it was only
throughout the
during
period.
throughout the period. Only during my surgery time, I would take 1 week to 10 days off so that I could recover. And I even worked from hospital also on certain occasions,
Okay.
because that helped me to divert my mind. And it was always good that yes, something is happening. Life has not stopped, so that keeps you going. If you just disconnect yourself from work and from world, so that makes you feel that you are left behind something. So I did not wanted to feel left out, I wanted to be included. So I kept working throughout my journey. So only there were times when I could not work, there were times I could not work longer hours. So if it's an 8-hour job, I would not work 8 hours, I would work 5 hours or 6 hours. So that was all. So that's how. So yeah, that's how I would even suggest people that you should not stop doing from what you have always been doing, because that is the road to recovery. So that helps to recover faster when you meet 10 different people. So your energy levels automatically comes to you. Otherwise you say, all right, मैं ठीक हो जाऊंगी तब काम करूंगी ये करूंगी. But there's never a right time to do that. It's the right time is when you feel that yes, you still want to do it. And that's the reason that can keep you going further. So मैंने भी यही किया. So I did not stop working at all. तो उससे मुझे काफी
But
मदद मिली मेंटली.
this is a very very positive attitude, of course, towards work, towards life. But not everyone has this kind of a attitude. Like कभी आपको हॉस्पिटल में काम करते हुए कोई दिखे और आपको बोले कि अरे ऑर्गेनाइजेशंस कैसी हैं, उनका काम रुका जा रहा है, आई मीन कांट दे रियली स्टॉप, लाइक कांट दे जस्ट लेट हर हील, ऐसा
सर आई
ऐसा
वुड से
मे
मेरे
बी।
जो डॉक्टर, हाँ कई बार ऐसा होता है, जो मेरे डॉक्टर में ट्रीटिंग डॉक्टर थे जिन्होंने मेरी सर्जरीज की थी, डॉक्टर परवीन भाटिया फ्रॉम सर गंगाराम हॉस्पिटल. सो उन्होंने मुझे एक ही चीज बोली कि इरा, तुम ठीक हो, तुम्हें हुआ क्या है, यू आर अ सर्वाइवर, यू आर अ फाइटर, तुम्हें यू आर नॉट सिक. See, he kept saying each time whenever I met him and whenever I was admitted 3 times, he performed surgery on me. And the next day he would say, कि all right, go and walk. So I would say कि नहीं, मुझसे नहीं, मुझसे चला नहीं जा रहा, कि let me see how you cannot walk. Everybody is able to walk. Let me see how you are not able to walk. And he would come and say, see, I'm holding you. Don't worry, I'm holding you. I will not let you fall. I said, no, I can't even I can't feel my legs because my legs were very, very numb. But he is a kind of a person who always motivate his patients even till date. It's been more than 6 years now. I am still in touch with my doctor, and he keeps asking about my health. He keeps sending motivational messages every day. So he makes sure that the patient looks good. He says either you inspire or you expire. That is what he
Oh,
feels.
amazing,
So
amazing.
I always kept that in mind, that yes, I want to inspire, I don't want to expire.
At least this is not the right time.
Right, absolutely, absolutely.
ओके, सो 6 साल हो गए हैं सर्जरी को, 6 साल हो गए क्योर हुए हुए. हाउ इज द लाइफ नाउ, लाइक लाइफ आफ्टर कैंसर, लाइक आई वांट टू नाउ डिस्कस दिस साइड ऑफ द लाइफ.
So first of all, I each day I thank God कि yes, I was able to make it. और वो पीरियड डेफिनेटली डिफिकल्ट था, पर अभी पीछे मुड़ के देखती हूँ तो मुझे लगता है कि अच्छा ठीक है, 1 साल की बात थी, इट वेंट थ्रू, ग्लैड आई मेड इट, ग्लैड आई फॉट इट, ग्लैड आई डिड नॉट गिव अप. बहुत सारे टाइम आए जिस समय लगा था मुझे कि अब नहीं होगा, अब इससे ज़्यादा कि इससे बेटर है मैं आई वुड गो. सो कई बार ऐसा भी आया. पर फिर बच्चों के चेहरे सामने आते थे, पेरेंट्स के आते थे, बच्चों से ज़्यादा आई वुड से मेरे पेरेंट्स के ज़्यादा आते थे. कि आई न्यू कि बच्चे तो चलो ठीक है, they will be people to support. My sisters are there, my brother is there, so everybody was there to support them. But when it comes to parents, they can definitely not see their child suffering so much. So I would say that whenever I would see my parents face, that would make me feel कि no, I have to do it. सो अभी मैं देखती हूँ तो ये ये सब लगता है कि हाँ, ये छोटा सा ही, तब उस समय लगता था कि बहुत लंबा पीरियड है, पर अभी लगता है कि 1 साल की तो बात है, दैट्स फाइन. सो दैट 1 year taught me a lot of things to live life and to appreciate all things in life. I appreciate walking. I appreciate the fresh air that I can breathe. When I was in hospital, there was a time I was hospitalized for 25 days and I hadn't seen the sky also. So when I came out of the hospital, the first thing I drew down the window panes of my car, and I was looking out of the window. Even though it was summer, it was very hot, but I just felt very nice to breathe that air, to look at the sky, and to hear the sounds of traffic, birds, everything. So everything felt so good because I was seeing it after 25 days. So आज मैं देखती हूँ तो ठीक है, lifestyle definitely it has changed a bit. I'm more considerate about what I eat. So there are things which I avoid, like whole grains makes me feel very bad. So my stomach doesn't accept whole grains very nicely. So definitely, once your body has gone through surgery, it will never be the same again. But then you have to live to see what works best on your body, what doesn't work. तो मैं भी यही ध्यान रखती हूँ कि जो चीज़ें मुझे सूट नहीं करती हैं, आई अवॉइड दोज थिंग्स, कि मुझे ठीक है ये नहीं खाना है, वो नहीं खाना है. तो that helps. And yes, meeting the doctor regularly is very important. Initially, it was like 3 months. Every 3 months, I was seeing my oncologist, and first 3 years it was like that. And I also got through PET scan, so that was done after 1 year of completion of my surgery. Then regular follow-up with doctors was also there, and they never felt the need to go through PET scan again, because I did not have any kind of symptoms that would suggest that I require another PET scan. But yes, now I'm meeting my doctor once in a year only, so just to make sure that everything is fine, I get my health checkups done every year. So all that annual checkups, so वो सब मैं करवाती हूँ. वो ज़रूरी है मेरे ख्याल से. आफ्टर 40 everybody should get it done. और अगर आपके फैमिली में, किसी की भी फैमिली में कैंसर रिलेटेड कोई भी इंसिडेंट है, तो आई थिंक अगर इमीडिएट रिलेटिव्स में लाइक पेरेंट्स है, या फर्स्ट आपके सिस्टर्स ब्रदर्स में से किसी को है, तो आई थिंक द फैमिली all the brother and sisters or your siblings should get themselves tested once they have crossed 35 years or 40 years of age. So वो screening बहुत important है, so that early diagnosis is definitely much better than getting it diagnosed at a later stage.
एक चीज़ को जो मैंने आज जो सीखी, और मुझे लगता है कि हम सबको पता तो है बट हम सबके सब बहुत ईज़िली इग्नोर करते हैं, वो ये कि just appreciate the simple things in life. As simple as that, maybe breathing the fresh air. As simple as that, just listening to the birds chirping sound.
Right.
Because हम सब ये सब चीज़ें कितनी आसानी से इग्नोर कर देते हैं अपनी डे टू डे लाइफ के अंदर, बट
Correct.
आप जब बीमार हो जाते हैं, एक कमरे में कैद हो जाते हैं और अपने आप को क्योर करने की कोशिश कर रहे हैं, पर साइमल्टेनियसली अंदर का जो दिल है वो तो नहीं जाता, वो तो आपका चाहता है ना कि आप बाहर जाएं, यू एंजॉय द लाइफ, यू नाउ सी दिस ब्लू स्काई फॉर दैट मैटर, बट वो सब आपको देखने को नहीं मिलता है.
Correct. Very true.
तो ये सब चीज़ें तो नो डाउट अबाउट इट, एंड नो आई वुड से be as simple as you can through this
Very,
podcast. That is one. Two, I believe that हर उस बुरे इंसान से और मे बी नेगेटिव लोगों से अपना कनेक्शन ब्रेक करिए जो कि आपको थोड़ा सा पुल डाउन कर रहे हैं. मे बी हैव जस्ट पॉजिटिव पीपल अराउंड. टू, थ्री, अगर आपको किसी भी समय अगर हेल्प की ज़रूरत है तो जस्ट आस्क फॉर हेल्प. There may not be 100 people coming helping you, but there may be 5 for that matter. But they will
absolutely.
come. And वो 5 हाथ ज़रूर आएंगे, 5 लोग ज़रूर आएंगे आपकी हेल्प करने के लिए. And then the most important thing that stay positive. क्योंकि कुछ भी हो जाए, I think अगर आप पॉजिटिव हैं तो दुनिया की हर जंग आप जीत सकते हैं.
Very true. Very true.
Thank you so much for joining with us on this podcast, Ms. Ila. It was
Thank you
great
so
having
much.
you.
Yeah. Thank you so
Your
much.
your your journey
I'm
was
glad you
really
are doing such things.
your journey is very, very inspiring.
Thank you so much.
Thank you.